Good morning, everybody. Okay. So you need to be very careful because the temperature of Delhi is fluctuating very fast. Today it is relatively warmer as compared to yesterday. पता है कि नहीं? तो रोज डेली बेसिस पे चेंज हो रहा है. कल को क्या होगा कुछ पता नहीं. So today we are set out to begin with therapeutic approach. And in therapeutic approach, you will be required to use the informations and concepts that you have acquired in the topic of personality chapter. So we had given extra time to personality chapter so that you have easy time in dealing with this kind of applied topics like therapy, right? So therapeutic session. Okay. Now I see Pradeep online. क्या Pradeep class नहीं आया तुम? So we will see the different schools of personality and how they have attempted to give relief to the patients or their clients, right? Now, remember, out of all the therapies that we will discuss, in all therapies, the patient will be known as client. So nowhere you will write patient, you will write client. Okay? It's only for behavioral therapy that you will use the word patient. Because behavioral therapy believes the patient is a patient, he is not a client. His behavior has to be modified. So they treat the subjects, they treat the patient as a subject, over which they carry out their operations, right? So beginning with psycho, yeah.
Sir, I had a doubt.
Yeah, just a moment. Yes, Neha.
So you told us about paranoid disorder. We were supposed to write about paranoid schizophrenia in that. So could you just in a brief tell us as to what all points we could write, because in terms of notes we discussed it very briefly. So just a few pointers if you could.
Okay. Why not? Good question. See, if they ask you about paranoid disorder, simply they ask you about paranoid disorder, you are going to write about the definition of the paranoid disorder, that it is characterized by delusion, and mainly the delusion of grandeur and delusion of persecution. Okay. Paranoid disorder is also a kind of schizophrenia, which is called paranoid schizophrenia. In paranoid schizophrenia, the psychotic symptoms are evident. There are three phases of paranoid disorder: prodromal phase, active phase, and residual phase. The psychotic symptoms of delusion and hallucination may appear in the active phase, and the causes and etiology are common.
Okay, sir. And sir, another doubt, are we not going to discuss substance abuse disorders?
We will discuss. I will discuss substance abuse disorder because I have already given you the information about the substances. I will discuss substance abuse disorder in the topics to come. Okay, especially when I discuss mental health, I generally take up substance abuse disorder.
Okay, sir.
Okay.
Thank you.
So, psychoanalytical therapy given by Sigmund Freud is an insightful therapy. It is an insightful therapy because it attempts to give the client an insight into his or her unconscious. It is known as insightful therapy because it attempts to give the client an insight into his or her unconscious. According to Freud, the anxiety experienced by ego, may have a cause in the repressed motives and urges, in the repressed motives and urges that have been pushed to the unconscious. May have a cause in the repressed motives and urges pushed to the unconscious. In other words, the present day problem of the client, the present day problem of the client may be traced back. The present day problem of the client may be traced back to their pathological past. The present day problem of the client may be traced back to their pathological past. Okay. So whatever problems you are facing in the current life, it has a connection in your past childhood, which have been pathological. Okay. This is the assumption. Now, the ego rests in our conscious. The ego rests in our conscious, while much of the aid is located in unconscious. Ego lies in conscious, while much of the aid lies in unconscious. So when the repressed urges or impulses, when the repressed urges and impulses try to surface out, therefore, when the repressed urges and impulses try to surface out, the conscious inhibitions produced by ego block their release. The conscious inhibitions produced by ego block their release. So unconscious impulses are guarded against release in conscious. They are guarded against surfacing out in the conscious by what? Ego. Okay. However, if the conscious inhibition can be lowered, please come. However, if the conscious inhibition can be lowered, the unconscious motives may spill out. The unconscious motives may spill out either in form of Freudian slips or dreams. The unconscious motives may spill out either in form of dreams or sleep. Freudian slips or dreams. Okay, they may come out either in form of Freudian slip. Freudian slip is a slip of tongue. You end up saying something which you did not intend it consciously. Now that word that is coming out, it is plopping out from the unconscious. Okay. Now Freud believed that when past repressed motives, Freud believed that when past repressed motives are examined with adult reality, when past repressed motives are examined with adult reality, they appear to be trivial. And they lose their fear appeal. They become trivial and they lose their fear appeal. When past repressed motives are examined in adult reality, they appear trivial and they lose their fear appeal. And the client develops insight. after knowing the cause of his anxiety. And the client develops insight after knowing the cause of his anxiety. Such an insight helps the client overcome his anxiety as well as release his pent-up feelings. Such an insight helps the client to overcome his anxiety and release his pent-up feelings. Now, there are 4 methods in psychoanalysis. Method number 1 is free association. Free association. Now, what is done here? The client is made to recline on a comfortable couch. The client is made to recline on a comfortable couch. Okay. The client is made to recline on a comfortable couch while the therapist takes a rear position. So therapist will be standing behind the client. He will not face the client. So therapist will take the rear position. And now the client is encouraged to speak and talk freely, whatever comes to his mind. And now the client is encouraged to talk freely, whatever thoughts run through his mind. Whatever thoughts run through his mind. The client's speech is recorded for later analysis. The client's speech is recorded for later analysis. The therapist looks for the words that represent slip of tongue. The therapist looks for those words which represent slip of tongue. Which the client would have wished to conceal. Which the client would have wished to conceal. There are certain repressed feelings in our unconscious which we do not want to reveal in public. And therefore, there is a lot of neurotic anxiety, how to control them, how to hide my private dark side from being revealed in public. Now, from that private dark side, some words may come out during the free talking, okay, which is called free association. The therapist with the help of the slips, develops insight. The therapist with the help of the slips develops insight into the unconscious. The client is made to recognize and accept. The client is made to recognize and accept their pathological past. as natural course of development of personality. The client is made to accept their pathological past as natural course of development of personality. तो ये तुम्हारे ही साथ नहीं, सबके साथ होता है. तुम इस बात से परेशान हो रहे हो, उसको बता देना है. ठीक है? This is free association, one of the technique. A more effective technique is technique number 2 called dream analysis.
How are they sure about it? How do they get into that Freud is living?
That is totally intuitive theory of Freud. ये सिगमंड फ्रॉइड के अलावा कोई नहीं जानता था that on what grounds does he say that these are words coming from unconscious. His entire therapy was based upon his intuitions, and because his intuitions were often helpful in correcting the abnormal behavior of the client, we accepted them as a theory. Okay? Nobody knows that why he is saying that this is a Freudian slip. Okay? So we do not have any scientific proof about what Freud is saying. It is totally intuitive theory. Okay?
Sir.
Yeah.
Sir, voice is recorded for later analysis.
Yeah, later analysis.
If sir, this client is informed about this recording, then client may be conscious about his or her speech.
That is why the therapist is standing behind the couch and he is giving him suggestion to relax and talk freely. Okay? But yes, you have to give him the information that your voice will be recorded for examination purpose. Without giving the information, it will be unethical. ठीक है? आप कहीं देखो, आपके पास कस्टमर केयर का भी फोन आता है तो क्या बोलते हैं पहले? This conversation may be recorded for training. मतलब बिना आपको इन्फॉर्म किए कोई अगर रिकॉर्ड करता है आपकी आवाज तो वो कानूनन गलत है. It will not be admitted in the courtroom and it will be subject to legal persecution on the person who has recorded. ठीक है? जैसे मान लो तुम्हारे घर में घुस के कोई गाली गलौज कर रहा है, तुम अगर उसका वीडियो बना रहे हो तो तुमको उसको बोलना पड़ेगा, देखो मैं शूट कर रहा हूं तुम्हें, आई एम शूटिंग यू. ठीक है? तो आप बिना सामने वाले को बताए उसका रिकॉर्डिंग नहीं कर सकते. ये टेक्निकली पॉसिबल नहीं है, एथिकली पॉसिबल नहीं है. दैट इज व्हाई यू हैव टू मेक द क्लाइंट रिलैक्स इन सम अदर वे, बट यस ही विल बी नोइंग दैट हिज वॉइस इज बीइंग रिकॉर्डेड. एंड दैट इज व्हाट इज द क्रेडेंशियल ऑफ द therapist also. When you visit a therapist, you are sure that he is like your lawyer. He will not reveal whatever you disclose to him. आप अपने लॉयर के पास जाके बोलते हैं ना कि मैंने मर्डर किया है, मुझे बचा लो वकील साहब. लॉयर थोड़ी कोर्ट में जाके बोलता है कि मर्डर किया मेरा क्लाइंट. इतना भरोसा अगर नहीं है तो लॉयर किस बात का? ठीक है? So with that confidence, people visit the therapist, right? Neha, you want to say something?
I want to ask whether in free association the client is in unconscious state or is he conscious?
He is conscious. He is conscious, but his conscious inhibitions are relaxed because he is lying down comfortably in the couch.
So, but still, if he's conscious, wouldn't his
He
conscious?
is conscious but not alert. He is conscious but not alert. He is relaxed. So as alertness reduces to relaxment, the inhibition of consciousness reduces.
Okay.
ठीक है? आप ऐसे समझ लो, जैसे आप मेरे सामने जब बात करोगे तो आपका कॉन्शियस इनहिबिशन बहुत स्ट्रांग होगा, लेकिन जब आप दोस्तों के साथ बात करोगे तो बहुत सारे शब्द अब ऐसे बोलते जाओगे धड़ल्ले से जो कि शायद मेरे सामने इस्तेमाल ना करो. आर यू गेटिंग इट? ये वही बात है, और इसीलिए थेरेपिस्ट पीछे खड़ा है कि वो कॉन्शियस ना हो जाए. ठीक है? नाउ ड्रीम एनालिसिस. द क्लाइंट इज आस्क्ड टू कीप अ नोटबुक and a pen beneath his pillow every night. The client is asked to keep a notebook and a pen beneath his pillow every night. And write down whatever he can recollect from the dream. And write down whatever he can recollect from the dream the client has seen that particular night. So as soon as you wake up in the morning, write down the dream, if you remember, and whatever you remember out of the dream on a notebook. लिख लीजिए. ठीक है? This exercise is done for a week. This exercise is done for a week. Subsequent to which the client submits the notebook to the therapist. Subsequent to which the client submits the notebook to the therapist. Okay. The dreams are analyzed. The dreams are analyzed by reversing the process of dream work. Dreams are analyzed by reversing the process of dream work. Now, what is dream work? Dream work involves disguising the dreams. Dream work involves disguising the dreams to make them non-threatening. Dream work involves disguising the dreams to make them non-threatening, so that even if they are remembered next day, they don't disturb you in your waking hours. They do not produce sense of guilt that you saw such a bad dream. Okay? So they are disguised, disguising the dream to make them non-threatening. Now, in the process, the latent content, which is the original content, in dream work, the latent content is transformed into manifest content. The disguised version is called manifest content, what you actually see in the dream. So unconscious forces disguise the dream, because if it is coming in raw form, then again, even in sleep, you have some amount of consciousness left. It will not let it being seen. So the unconscious forces disguises the dream, which is very raw and which is very anxiety provoking or maybe very threatening, because it is coming from your pathological past. It will be modified into manifest content, and what you will see will be different characters, different faces, but the feelings that you will undergo will be of somebody known to you, somebody very close to you. Okay? So latent content is converted into manifest content, which is non-threatening version, which you actually see. Now, in dream analysis, simply this process is reversed. Manifest content is reversed and latent content is discovered. So in dream analysis, the manifest content is interpreted to know. In dream analysis, the manifest content is interpreted in order to know or discover the latent content. Okay? Sigmund Freud believed that dreams are symbolic versions, or dreams are symbolic in nature. Sigmund Freud believed that dreams are symbolic in nature. Okay? So whatever we see in the dream, whatever objects are seen in the dream, they represent something else. They are symbols. Symbols are something that represent something. Symbol का मतलब क्या होता है? Signs and symbol. Something that refers to something. So the objects seen in the dreams are symbols that indicate the latent content. Like dreaming about snake or rope is symbol of dreaming about male genitals. Okay? Dreaming about climbing a ladder symbolizes that somebody is dreaming about approaching an authority for sexual activity, an authoritative figure for sexual activity, say dreaming of having sexual relationship with the class teacher, ठीक है, in the school time, इस तरह का. तो आप देखेंगे सीढ़ी चढ़ रहे हैं। तो हर ड्रीम का एक सिंबॉलिक मतलब होता है, उस सिंबल को सिगमंड फ्रॉइड ने तैयार किया था, एंड थ्रू हेल्प ऑफ विद द हेल्प ऑफ दोस सिंबल्स द मैनिफेस्ट कंटेंट इज कन्वर्टेड इनटू लेटेंट कंटेंट. The client is now informed about the latent content and helped to develop insight. The client is now helped to develop insight. ठीक है? Informed about the latent content and helped to develop insight. Now, third one. The third method is transference. Transference, analysis of resistance. Analysis of resistance. While having a conversation with the client, the therapist inquires about the client's past. While having a conversation with the client, the therapist inquires about the client's past. The client may show resistance in talking about some aspects of their past. The client may show resistance in talking about some aspect of their past, or may jump abruptly from one topic to another without reaching the conclusion. ठीक है? Wherever such resistance are shown, it represents neurotic anxiety. Wherever such resistance are shown, it represents neurotic anxiety. The therapist gives the client insight. The therapist gives the client insight about his or her anxious past, which is causing neurotic anxiety. His or her anxious past, which is causing neurotic anxiety. So neurotic anxiety means the anxiety of ego that I should not reveal what I want to conceal. तो जहां जहां रेजिस्टेंस दिखा रहा है वहां वहां वो खुद हाईलाइट कर दे रहे हैं कि देखो मुझे प्रॉब्लम यहां है, तो उसी चीज पर उसको गहराई से इंसाइट दी जाती है. ठीक है? एनालिसिस ऑफ रेजिस्टेंस. एंड देन फोर्थ कम्स ट्रांसफरेंस. Now, before you write, you understand. होता क्या है? Suppose the son has some problem with the father, but father is a respectable figure, so he cannot release his pent-up feeling or anger over father. But he has a lot of complaints from childhood against his father, and because he is not able to release that complaint, release that anger, he is suffering from anxiety. He is disturbed mentally. Now he goes to the therapist. And then he meets the therapist in intermittent sessions, but they meet quite frequently. They keep meeting not only in the treatment room. Shruti Mathur? Okay. अरे सवाल कैमरा घूम गया, 1 मिनट, ठीक। तो क्या होगा कि सिर्फ उनके चेंबर में नहीं, क्लाइंट डॉक्टर के चेंबर में ही नहीं, आउटसाइड ऑल्सो, से इन कैफे कॉफी डे, in marketplace or some outstation, some hill station, both may go. So the purpose here is that over a period of long time, the client and the therapist should form a relationship between each other, in which the client will be encouraged to transfer his emotions towards his father, towards the therapist. So the emotions or the complaints which he has towards the father should be transferred towards the therapist, and then he should release his complaint in a safe therapeutic setting. As he would release his complaint, the therapist would explain him, the reasons for his father or her father for doing that. And when this reason will be examined through adult reality, it will become trivial. Okay, so what is transference? The therapist and the client, now you may write. The therapist and the client meet with each other frequently both inside and outside the treatment center. Therapist and the client meet with each other frequently, both inside as well as outside the treatment center, so that they can develop an interpersonal relation ठीक है. The client transfers his or her feelings. The client transfers his or her feelings from the personal life the client transfer his or her feelings from the personal life over the therapist. Now the client is encouraged to release his pent-up feelings, his grudges and complaints. Now the client is encouraged to release his pent-up feelings, his grudges and complaints over the therapist. This process is known as transference. This process is known as transference, and the advantages of transference are: first, the client is able to cathect his pent-up feelings, cathect his or her pent-up feelings, मतलब release his or her pent-up feelings, तो उसका मन हल्का हो जाएगा. Second, the therapist re-educates the client emotionally. The therapist re-educates the client emotionally. The therapist re-educates the client emotionally. but there is a problem. However, there is a problem of counter transference. Now, since the client and the therapist get emotionally connected, it may be possible that therapist may transfer his personal feelings over the client. It may be possible that the therapist transfers his personal feelings over the client, which is known as counter transference. तो फिर वो क्लाइंट संभाल नहीं पाएगा, ठीक है? Therefore, before practicing psychoanalytical therapy, the therapists themselves have to go through psychoanalytical therapy. So before practicing this therapy, the therapists themselves have to go through psychoanalysis or psychoanalytical therapy. तो कोई भी ऐसे नहीं कर सकता, पहले ये थेरेपी खुद को लेना पड़ेगा, अपना पूरा का पूरा पैथोलॉजिकल पास्ट क्लियर कर देना होगा. Only then you can practice this. Otherwise, it is possible that you may transfer your feelings over the client. Yeah.
सर, अगर जो थेरेपिस्ट है वो अगर अपना फीलिंग एक्सप्रेस करता है तो हेल्प होगा सर?
नहीं, हेल्प कैसे होगा? मान लो आपको अपने पिताजी से प्रॉब्लम है और आप मुझ में अपना पिताजी देख रहे हैं और आप अपनी भड़ास निकाल रहे हैं. अब मान लो मुझे भी अपने बेटे से प्रॉब्लम है, ठीक है, और मैं तुम में अपना बेटा देखना शुरू करूं और मैं उल्टा भड़ास निकालने लगूं, अरे चुप कर, तूने क्या किया था, तुझे याद है? फिर तो वो झगड़ा हो जाएगा. आर यू गेटिंग इट? यहां तो है कि उसके पेंट अप फीलिंग को रिलीज करवा रहा है, उसको इमोशनली रीएजुकेट करना है. उसमें आई शुड बी न्यूट्रल.
सर, उससे निकलवाने के लिए जो उसकी पेंट अप फीलिंग है,
हाँ,
वो तो उससे रिलेट करवाना पड़ेगा सर.
रिलेट करिए, लेकिन आप अपने ग्रजेस को उस पे मत डालिए ना. मान लो थेरेपिस्ट का अपने बेटे से कोई शिकायत हो और वो उस क्लाइंट में अपना बेटा देख रहा है, तो वो अपना भड़ास भी उस पर निकालने लगेगा. अब वो बेचारा तो इनोसेंट है. तो काउंटर ट्रांसफरेंस नहीं होना चाहिए, ठीक है? कोई भी डॉक्टर जो है उसको इमोशनल नहीं होना चाहिए. मेरी बात समझ रहे? कोई भी डॉक्टर शुड बी प्रोफेशनल, दे शुड नॉट बी इमोशनल. सो दे शुड नॉट कैरी समथिंग फ्रॉम देयर पास्ट. So these are the 4 methods. And now let us see the limitation of psychoanalytical therapy. Limitations. Psychoanalytical therapy suffers from Yavis syndrome. पहला लिमिटेशन है Yavis syndrome. This therapy cannot be availed by everyone. The client need to have certain characteristics. The clients need to have certain characteristics so that they can take up this therapy. So it is not for the masses. It is for some elite classes. जैसे Y stands for young. The client has to be young. Otherwise, he cannot project the feelings of father or mother over the therapist. So therapist का क्या उम्र होगा? क्या लगता है आपको कितना होना चाहिए therapist का उम्र? If therapist is 40-50, then the client should not exceed 25. तभी वो ट्रांसफरेंस हो पाएगा. Are you getting it? So the client has to be young. अगर client खुद 60 साल का है तो उसको therapist क्या 120 साल का लाके दोगे? So it cannot be taken by senior citizens. ठीक है, इसके लिए young होना पड़ेगा, young age में लेना पड़ेगा. The therapy is very expensive. Any type of counseling therapy in psychology is much more costlier than medicinal therapy. तो साइकेट्रिस्ट को आप एक विजिट में अगर 1000 रुपया फीस देते हैं, क्लिनिकल साइकोलॉजिस्ट एक विजिट का 3000 या 5000 ले सकता है, क्योंकि वो वकील वाला काम कर रहा है. वो पूरे आपके थॉट प्रोसेस को बिना दवाइयों के ठीक कर रहा है. ही इज करेक्टिंग योर मैलएडेप्टिव कॉग्निशन विदाउट एनी मेडिकेशन. सो द एफर्ट इज ऑल्सो मोर ऑन द पार्ट ऑफ काउंसलर, and his exercise, he will require many number of sittings For example, I said that the therapist and the client have to go for outing in a hill station, celebrate vacation. Only then that relationship or transference will take place. So it cannot be afforded by poor man. The client has to be affluent. जेब में पैसा होना चाहिए. पहला है young, दूसरा है affluent, third is V. The client should have good verbal ability. He should be able to express exactly what he is feeling. ठीक है? I, he should be intelligent. Only then he can develop that insight. You know, and to have all these things, he must be successful in life. So this is called Yavis syndrome. YAVIS. ठीक है? तो सब लोग नहीं ले पाएंगे. बहुत कामयाब लोग, बहुत पैसे वाले लोग, बहुत बुद्धिमान लोग, बहुत अच्छा बात करने वाले लोग, उन्हीं के लिए ये थेरेपी है. ठीक है? Problem number 2. The therapy, psychoanalytical therapy, cannot be used for treating severe mental disorders. They are appropriate for mild disorders. They are appropriate or suitable for mild mental disorders. They cannot be helpful in severe mental disorders. वहां पर फिर वही behavioral therapy best है. Third, it is probable that the therapist may use his subjective interpretations it is probable that therapist may use his subjective interpretations and impressions while making insight into the unconscious. Therapist may use his subjective impressions or interpretations while making insight into the unconscious. Like he may give his own interpretation to the manifest content, or he may give his own interpretation to the analysis of resistance, or he may give his own interpretation to the words which were spoken during Freudian slips. Now, if he is giving own interpretation, subjective interpretation, then the therapy may not be accurate. ये भी problem है. And fourth, the therapy is past oriented. The therapy is past oriented and does not take into account the present day stressors and does not takes into account the present day stressors. Okay, does not takes into account the present day stressors. Okay, and now psychoanalytical therapy has been advanced to include the present day problem also by the followers of Sigmund Freud, who are called Neo-Freudians. So Neo-Freudians have now come up with the advanced version of psychoanalytical therapy, which is known as psychodynamic therapy. Psychodynamic therapy given by Neo-Freudians. And here we have a therapy known as interpersonal therapy given by Harry Stack Sullivan. Interpersonal therapy given by Harry Stack Sullivan. I want a minute before I start this therapy. It's very interesting therapy. If you remember the interpersonal theory of personality given by Harry Stack Sullivan, he was the person who said that there is no real entity called personality. At best, personality is an hypothetical entity. Okay? It is an hypothetical entity that takes new shapes with every reoccurring interpersonal situations. For example, you have a personality as read by your friends when you are in the friend circle. You have a different personality when you are with your parents. So your parents know you as somebody which may not be the similar way your friends know you as somebody. So therefore, you have two personality. One personality with your friend, another personality with your parents, another personality with your girlfriend, boyfriend, another personality with your, say, superiors, another personality with your subordinates. So you have multiple types of personality. So there is nothing called personality that gives you a consistent way of behaving in all situations. So you play multiple roles in this society. So what is your true personality that cannot be known? So personality is an hypothetical entity that keeps changing itself in reoccurring interpersonal situations. Okay? Now this is called interpersonal theory of personality. Now what causes maladjustment in people's life? You understand this. Okay. No problem, Pradeep. Acha. Now suppose you meet somebody. Okay? And then you make a impression about that person. You form an impression about that person. Now the impression that you form about the person depends upon your experience with interaction with your experience while interacting with that person. Okay? Now suppose during the interaction with a person, with a stranger for the first time, your experience was bad. So you develop a schema. You develop a schema, a faulty schema, that all strangers will leave me with a bad experience. Whenever I see somebody who is not known to me, a new person, I have to be extra careful. They can be threatening, they can be dangerous, they can be harmful. So we have unlearned and maladaptive or faulty schema that people, when we interact with strangers, we should find what are the negative qualities in them, because these negative qualities can be harmful and disturbing to me. So when you meet a person, we do not see what is good in that person. We try to judge him in terms of his negative characteristics. And therefore, everybody appears to be like an enemy. And that causes maladjustment in our day-to-day behavior. Why? Because this faulty schema has got consolidated in mind. कि हम लोगों से संभल के मिलेंगे. अब ये संभल के मिलेंगे जब भी आपके दिमाग में चलेगा तो आप देखेंगे कि ये आदमी कैसे कैसे बुरा हो सकता है, कहां कहां से इस आदमी से खतरा हो सकता है. तो हर एक आदमी आपको एक पोटेंशियल एनिमी या डेंजर लगेगा. And you will be disturbed in all the situations that you come across. So what is done in interpersonal therapy? The therapist will make the client or help the client to judge every new situation with a fresh outlook, independent of the faulty schema. Okay? So the client will be encouraged to see every new situation, every new interpersonal situation with a fresh outlook. With a zero acquaintance. Zero acquaintance means when you meet somebody for the first time with a blank mind, without any previous impression. Okay. So you are not having any previous impression. You meet every person with a zero acquaintance, zero schema or zero previous impression. And then you form impression about people. And you find that most of the people are friendly, very few might be threatening. Most of the people are friendly, few might be threatening. ठीक है? तो यही तरीका है. तो इसमें क्या करते हैं? According to Sullivan, personality is an hypothetical entity that keeps changing with changing or reoccurring interpersonal situations. It keeps changing with reoccurring interpersonal situations. During interpersonal interaction, during interpersonal interactions, we are left with an experience. We are left with an experience which is known as schema. Some experiences or schemas may be distasteful. Some experiences or schemas may be distasteful, which gradually gets consolidated into strong beliefs, which gradually gets consolidated into strong beliefs. The client may use these faulty beliefs while dealing with new interpersonal situations. The client may use these faulty beliefs while dealing with new interpersonal situations. So the client may approach every other individual with suspicion, doubt and fear. Therefore, the client may approach every individual with suspicion, doubt or fear. ठीक है? The therapist helps the client to meet with new interpersonal situation with a fresh outlook. With a fresh outlook, independent and detached from the faulty beliefs. The therapist encourages the client to meet the new interpersonal situation with a fresh outlook, independent and detached from faulty beliefs. Okay? So client is now supposed to meet every person as a zero acquaintance. The client is now supposed to meet every person as a zero acquaintance, as if I have not met him before or not met a similar person like him before. Zero acquaintance. And try to figure out the friendliness the person may offer. And try to figure out the friendliness the person may offer. So the maladjustment in interpersonal situations will be corrected. Okay? Maladjustment in interpersonal situations may be corrected. Yeah.
So what is the difference between interpersonal therapy and neuro-linguistic program? Are they kind of similar?
Neuro-linguistic program involves language, use of semiotic signs. Neuro-linguistic programming. It does not relates with the concepts of socialization or social interactions. Okay? तो वो एक हाईली स्पेसिफिक प्रोग्राम है दैट इज एसोसिएटेड विद आर्टिफिशियल इंटेलिजेंस। यहां पर हम लोग क्या करते हैं, यहां पर उसको हम लोग सोशलाइजेशन के रूल्स सिखाते हैं कि हाउ टू सोशलाइज विद डिफरेंट पीपल। अभी मैं आपको छोटा सा एग्जांपल बताता हूं। जैसे मान लो यू गो टू अ वेजिटेबल वेंडर, आप सब्जी खरीदने गए, आप सब्जी वाले से मोल भाव करते हैं कि नहीं? क्योंकि आपको लगता है कि वो आपसे ज्यादा पैसा ऐंठने की कोशिश कर रहा है, ठीक है। जब आपके घर में बिजली का बिल आता है तो भी क्या बिजली ऑफिस जाके मोल भाव करता है? नहीं करता ना। लेकिन अगर आप में ये टेंडेंसी है दैट यू आर डाउटिंग इवन द इलेक्ट्रिसिटी बिल विच इज अ प्रिंटेड बिल generated with GST, convenience charge, etc., and then you are doubting that it is a false bill, in which case you are having some problem with your interpersonal interaction. You have developed a faulty schema that all people are set out to cheat me. ठीक है। फिर आप क्या करेंगे, डॉक्टर के पास गए हैं, डॉक्टर इतना फीस क्यों ले रहे हैं, आखिर आप ऐसा क्या दवाई लिखिएगा कि फीस इतना ले रहे हैं? यू नो आप हर जगह पर गड़बड़ खा रहे हैं। तो आपको हेल्प किया जाता है दैट यू हैव टू जज एवरी न्यू सिचुएशन with a fresh outlook. This is interpersonal therapy. So that whatever bad experiences you have got in the past, let them be in the past. Now onwards, deal with every situation as a zero acquaintance. Okay? Okay. So this was interpersonal therapy. And now I come to the most effective therapy, which is helpful in treating even the severe mental disorders. Behavioral
Excuse
therapy.
me, sir.
Yes, please.
Sir, I had a doubt.
I'm coming. Just a moment.
Okay.
Yeah, Neha.
So in interpersonal therapy, where we're talking about schemas, faulty schemas that are corrected, even in cognitive therapy, somewhere we use this like schemas being corrected. So are they similar in some ways?
Yes, to large extent it is similar. The focus of interpersonal therapy is that we are talking about recurrent interpersonal situation. Sigmund Freud was talking about past situations. So here we are not focusing on pathological past, here we are focusing on pathological present. तो वो फॉल्टी स्कीमा उसके प्रेजेंट को पैथोलॉजिकल बना रहा है, उसको करेक्ट करना है। दूसरा चीज, दिस पर्सन कैन ऑल्सो, दिस पर्सन द क्लाइंट इज ऑल्सो हेल्प्ड टू चेंज हिज पर्सनालिटी एज पर रिक्वायरमेंट ऑफ द इंटरपर्सनल सिचुएशन. So there are situations like when he is dealing with his superior, he needs to be submissive. While he is dealing with his subordinate, he needs to be assertive. So as many personality as may be required by the situation, he has to keep that flexibility. So he should not provide himself with a fixed type of personality. तो बहुत ही डायनेमिक है. Cognitive therapy में क्या करते हैं? Apart from helping them learn what is the appropriate way of behavior, we try to restructure the faulty belief by replacing it with a better belief. You can say very, very similar and close to cognitive therapy.
Okay, sir.
बस फोकस
So-
इतना है कि ये सिगमंड फ्रॉइड के न्यू फ्रॉइडियंस ने दिया था. Yes.
And sir, another thing, in Harry Stack Sullivan's theory, where we did in personality, he talked about a balance between the social expectations and
expectation
the
and
psychological
personal.
needs, and that being a reason for faulty personality. So how does his therapy deal with that?
वही मैंने अभी आपको बताया. जैसे सपोज एग्जांपल, यू आर डीलिंग विथ योर सुपीरियर. With your superior, you cannot afford to be assertive. There you have to be submissive. But the price you are paying for being submissive will leave you with a residual tension. This residual tension can be released when you are relating with your subordinate. There you can be assertive. So the amount of submissiveness that you show to an authority can be compensated for by amount of assertiveness that you show to your subordinate, and hence your psychological needs will be satisfied. इसी की ट्रेनिंग होती है इंटरपर्सनल थेरेपी.
So it is like relativeness of different
Relativeness of
relations we
different
have.
relations. Exactly.
Okay, sir.
Exactly. So behavioral therapy. ठीक है. I said it is helpful in treating the severe mental disorders. अब इसमें करते क्या है? Behavioral therapy is based upon the assumption. It is not insightful. Remember, it is not insightful therapy. It is based upon the assumption that maladaptive behaviors can be modified. They believe in behavioral modifications. According to behaviorist, what causes distress to the patient? What causes distress to the patient is not the faulty cognition or schema. What causes distress to the patient is not the faulty cognition or the schema. It is the maladaptive behavior. What causes distress to the patient is not the is not the faulty schemas or cognition, it is the maladaptive behavior. Okay? Therefore, if the maladaptive behavior that has been learned can be unlearned, if the maladaptive behavior which has been learned, if that could be unlearned, it can lead to treatment, successful treatment. It can lead to successful treatment. So maladaptive behavior are consequence of faulty learning. If that faulty learning can be unlearned, then the problem is over. So they try to modify the behavior, not the thoughts. उनको mind से thought से कोई लेना देना नहीं है. आपका जो behavior disturbing है, मैं अगर उसको दूर कर दूं तो मामला खत्म. जैसे मान लो आप बात बात पे गालियां देते हो. Suppose while talking normally, you can't help control abusive words. Sigmund Freud will say a lot of pent-up feeling and aggression is coming out, spilling over. So that pent-up feeling has to be released. Cognitive psychologists will say that it is because of the faulty cognitions that you are speaking so abusive language. Behaviorist कहेंगे मुझे cognition thought से कोई लेना देना नहीं है, मैं सिर्फ इसकी गालियां बंद करा दूंगा. जैसे गाली दे एक थप्पड़, गाली दे दूसरा थप्पड़, तीसरा थप्पड़, धीरे धीरे गाली देना ही भूल जाएगा, वो बंद कर देगा, प्रॉब्लम खत्म. ठीक है? क्या करना है, दिमाग के अंदर क्या चल रहा है, ये सिंपली समझो. लातों के भूत बातों से नहीं मानते, इस बात को ये लोग बिलीव करते हैं. So according to behaviorists, what can be learned can also be unlearned as well as relearned by manipulation of the environmental determinants. By manipulating the reinforcement and punishment, anything can be learned and anything can be unlearned. For example, phobias. You have learned to fear harmless objects. So what are the techniques involved in behavioral therapy? Beginning with shaping. क्या था definition shaping का? Shaping involves successive approximation towards perfection or desired response, towards perfection or desired response by means of selective administration, by means of selective administration of reinforcement and what? Punishment. Successive approximation towards perfect behavior or perfection by means of selective administration of reinforcement and punishment is called shaping. So with every desirable response, the client is reinforced. The client receives reinforcement. For every desirable response, the client receives reinforcement. And for every undesirable response, the client receives punishment. For every desirable response, the client is given reinforcement. For every undesirable response, the client is given punishment. This raises the tendency for desirable response and weakens the tendency for undesirable response. This raises the tendency for desirable response while weakens the tendency for undesirable response. ठीक है? Shaping is best done. Shaping is best done through token economy. Now I will explain you what is token economy. Token economy. They can ask you a separate question from token economy also, short question. Now, what is done in token economy? The client who is kept under institutional setup, जो कि ट्रीटमेंट के लिए आया है, मान लो हॉस्पिटल में है, मेंटल हॉस्पिटल में, the client will win reward points for every desirable behavior. For committing a desirable behavior, there are reward points which are given to the client. These reward points are known as tokens. As the client accumulates or gathers more and more tokens, the value of the token increases, the value of the reinforcement increases, which the client can later on exchange for a preferred activity. Okay? So suppose the client wants to watch a movie, but he cannot go outside the mental asylum and he is not being given the access to television watching. He wants to watch TV or movie, or he wants to play cricket or football. तो अगर आपको ये सब करना है, in that case you have to earn some tokens. So he will show the frequency of desirable behavior more often, and as a consequence he will earn a lot of tokens, and then he can get the tokens exchanged against the preferred activity. So token economy involves the use of, अगर आपको याद हो learning chapter से, pre-mark principle. The child wants to play, the parents want them to finish the homework and then go to play. So doing a less preferred activity for a more preferred one, pre-mark principle. Yeah, token economy. Okay, so you can write, the patient receive reward points in form of tokens. The patient receives reward points in form of tokens for every desirable behavior. As they accumulate substantial tokens, they may exchange the tokens for preferred activities or objects. They can exchange the tokens for preferred activity or object. So suppose one wants to meet with one's family members. Okay? So family members have a meeting time कि महीने में एक दिन मिलेंगे, एक बार ही मिल सकेंगे. लेकिन अगर वो 2 बार मिलना चाहता है तो उसको टोकन कमाना होगा, and then he will be having access to meet his family members. कुछ भी preferred activity, कोई object चाहिए. Suppose you want a football for yourself so that you can spend your time with it, तो आपको टोकन कमाना होगा. ठीक है? Now, the advantage with token economy is that it is intermittent in nature. The reinforcement is intermittent in nature, which makes it more resistant towards extinction. Now suppose for every desirable behavior the client is given a reinforcement. What will happen? This type of learning will fade away very soon. As soon as there is no reinforcement or you stop giving reinforcement, the desirable behavior will also stop happening. So if every correct response is given reinforcement, then the reinforcement will lose its appeal and it will be very fast unlearned in absence of reinforcement. But in token economy, you know that I will show n number of desirable behavior, only then someday I will get reinforcement. So your expectation for reinforcement is kept alive for longer time. So even in absence of reinforcement or even in case of delayed reinforcement, you do not stop giving correct response. You keep expecting a reinforcement and you give correct response. Moreover, because the reinforcement is coming intermittently, it also maintains its appeal. Okay? So second thing, the reinforcement does not loses its appeal. The reinforcement does not loses its appeal. Third thing, the tokens can be exchanged not only for objects but also for a preferred activity. The tokens can be gained not only for object but also for any preferred activity within bracket pre-mark principle. Okay? Within bracket pre-mark principle. And fourth, it develops internal locus of control. The client develops internal locus of control. So client does not need the therapist from the environment outside to control his behavior. He can bring his own behavior under self-control. It develops internal locus of control. क्यों? क्योंकि ये कमा रहा है. ठीक है? तो ये बहुत बड़ी बात है कि क्लाइंट अपने प्रॉब्लम को खुद ही कंट्रोल कर रहा है क्योंकि उसको टोकन अर्न करना है. ठीक है? So these are the advantages, and also it is cost effective. Second type of behavioral therapy is aversive therapy. Another type of behavioral therapy is aversive therapy. It involves administration of aversive or unpleasant stimulus for committing maladaptive behaviors. It involves administration of aversive or unpleasant stimulus for committing maladaptive behaviors. It is quite successful in the treatment of substance abuse disorders. It is quite effective in the treatment of substance abuse disorders like use of antabuse, use of drugs known as antabuse that produces taste aversion, or Garcia effect, that produces taste aversion or Garcia effect. So when you are, suppose an alcoholic person can't live without alcohol, he is given alcohol. But after consumption of alcohol, after some time has elapsed, since he has consumed alcohol, he will feel vomiting and nausea. So every evening when he consumes alcohol, after half an hour or so, he vomits. So he develops a taste aversion within few days for alcohol and he stops drinking alcohol. ठीक है? क्यों? क्योंकि टेस्ट अवर्जन हो गया. ठीक है? गार्शिया इफेक्ट आपको पढ़ाया था टेस्ट अवर्जन. ठीक है? तो ये एंटाब्यूज ड्रग होता है, उस अल्कोहल में वो ड्रग मिला देते हैं और फिर धीरे धीरे उसको उस अल्कोहल और नोजिया के बीच में, अल्कोहल के स्मेल और नोजिया के बीच में मेंटल कंडीशनिंग हो जाती है. So next time when he is out of the treatment center, whenever he will smell the alcohol, he will be reminded of that terrible nauseatic effect and he will avoid it. और ये बहुत ही इफेक्टिव होता है. ठीक है, डी एडिक्शन के लिए बहुत ही इफेक्टिव होता है. ओके, then another aversive therapy is the rubber band therapy. Rubber band therapy. A rubber band is tied to the wrist of the client, of the patient. Each time the patient commits a maladaptive behavior, each time the patient commits a maladaptive behavior, he is asked to stretch the band and snap it against his skin. Each time he commits a maladaptive behavior, the patient is asked to stretch the band and snap it against his skin. If the patient commits the maladaptive behavior very frequently, if the patient commits the maladaptive behavior very frequently, the repeated snapping will cause tenderness of wrist. The repeated snapping will cause tenderness of wrist, which will be a reminder for the patient to control himself. Which will be reminder for the patient to control himself. तो मान लो उस रबर बैंड को आप बार बार पटक रहे हो, तो शाम तक क्या होगा? टेंडरनेस आ जाएगा, रेडिशनेस आ जाएगा. इसका मतलब आज मैंने बहुत गलतियां की है, कल मुझे आराम देना है अपने रिस्ट को. तो नेक्स्ट डे आप क्या करेंगे? आप वो बिहेवियर कम करेंगे. ठीक है, नहीं, पेशेंट ट्रीटमेंट के लिए आया है ना, वो चाहता है खुद को कंट्रोल करना. ठीक है, वो रबर बैंड, वो फ्रेंडशिप बैंड टाइप होता है ना, उसी तरह का एक बैंड होता है. ये स्मोकिंग छोड़ने में भी इसका आता है, गालियां बंद करने में आता है. जैसे हर बार जब भी एक सिगरेट पियो, एक बार खींच के स्नैप कर लो. अगर शाम तक दिख रहा है कि टेंडरनेस है, तो इसका मतलब आज स्मोकिंग ज्यादा हो गया है, कल इसको कम करना है. इस तरीके से वाइकेरियस सेंसिटाइजेशन, ये बड़ा इंटरेस्टिंग है. थर्ड वन, vicarious sensitization. The patients are shown, patients or subjects are shown certain documentaries, where different characters learn lessons out of their mistakes. क्राइम पेट्रोल देखा है? उसमें क्या बोलता है? सबक एक को, सीख हम सबको. ठीक है, मतलब आपको दिखाया जाएगा कि एक आदमी के लापरवाही से कितना बड़ा विनाश हो सकता है. तो ऑल द पीपल हु आर वॉचिंग इट विल टेक प्रिकॉशन टू अवॉइड क्राइम इन देयर पर्सनल लाइव्स. तो वो क्या है? वो एक तरह का वाइकेरियस सेंसिटाइजेशन है, टू सेंसिटाइज द सोसाइटी दैट हाउ टू प्रिवेंट क्राइम. ठीक है, कौन कौन सी गलती हम लोग आमतौर पे करते हैं जिसके चलते क्राइम हो सकता है, तो वो दिखाते हैं। सीख एक को सबक नहीं, सबक एक को सीख हम सबको, यही बोलते हैं ना, टैगलाइन उसका यही है। ठीक है, सो इट इज हेल्पफुल इन ट्रीटमेंट ऑफ सब्सटेंस अब्यूज, it is helpful in treatment of substance abuse or gender insensitivity So here it is shown that how the female gender can be more cooperative, the daughter can be more cooperative as compared to the son. So the preference for boy child and ignorance of the girl child can be corrected through vicarious sensitization. Nowadays, vicarious sensitization are also done by pictorial or pictures, like the photographs of rotten lungs or rotten jaws in the packets of cigarette. ये क्या है? वाइकेरियस डिसेंसिटाइजेशन। आप जब भी देखते हैं पैकेट को, एक बार आपके मन में एक डर की भावना आती है और धीरे धीरे आप या तो सिगरेट छोड़ देते हैं या पैकेट की तरफ देखना छोड़ देते हैं। ठीक है, द लेटर इज मोर प्रोबेबल। अच्छा, इंडिया में ही है ऐसा गंदा गंदा फोटो देता है, दुनिया में और कहीं नहीं देता है। यू नो दैट, दुनिया में और कहीं नहीं देता है। हाँ, ईरान में गंदा फोटो तो नहीं देता है, लेकिन क्या देता है कि एक जूते का फोटो होता है, शू, एंड दैट शू इज प्रेसिंग द सिगरेट, वो जूता सिगरेट को बुझा रहा है। ठीक है, मतलब वो आपको एक थोड़ा जलील फील कराता है, देखो जूते का फोटो जेब में लेके घूम रहे हो। ठीक है, लेकिन इंडिया में इतना गंदा गंदा फोटो देता है।
यूएसए में भी देता है।
हाँ,
यूएसए में भी देता है सर।
नहीं, कहाँ देता है? यूएसए में नहीं देता है। देता है?
सर मैंने देखा था सर एक बार।
Don't know. Okay, so the other ways of behavioral therapy we will discuss tomorrow. ठीक है, अभी बहुत सारे behavioral therapy है, and tomorrow we are also discussing a very important therapy, that is humanistic therapy, and then we will move on to cognitive therapy. So happy Shivratri to all of you.
Excuse me, sir.
Yeah.
So a doubt. With respect to in general all of the behavioral therapies, here we're talking about treating the maladaptive behavior and not the cause of behavior. Like, so in such a case, it's only the symptom that is getting treated, not the underlying cause, right?
Yes, correct.
So then how is it the most effective? Because it is possible that in some other form, the behavior might come back again.
See, behaviorists believe that maladaptive behaviors are learned behaviors. So if we can make them unlearn the faulty behaviors and make them learn the better behaviors, that learning will last for great length of time. And if it relapses, suppose the faulty learning relapses, then the person has to visit again for repeated treatment. एक बार unlearning हो गए, फिर आप उस behavior को करेंगे नहीं. So they don't believe that we are doing maladaptive behavior with giving much thoughts. We are not doing maladaptive behavior thoughtfully. They are happening passively because of our deep learning. So if that deep learning can be erased, the maladaptive behavior will also disappear. So we are guided by tendency, not by thoughtful behavior. Cognitivists यही मानते हैं कि no, every behavior is thoughtful. उसके thoughts को change करो. इनको thought से कोई मतलब नहीं है, simply behavior को modify करना चाहते हैं. और सीवियर मेंटल डिसऑर्डर जिसमें कि हॉस्पिटलाइजेशन की जरूरत होती है, वो बिहेवियरल थेरेपी से ही ठीक होता है. ठीक है, सो टुमारो वी विल सी हाउ बिहेवियरिस्ट ट्रीट द फोबियाज एंड ऑल in conditioning, counter conditioning, systematic desensitization, etc., etc. So see you tomorrow.